So, hi my scholars, welcome to today's episode on Anatomy MCQs. And these questions were carefully synthesized in order to enhance our knowledge of anatomy and to make sure that we have a very good approach to answering anatomy questions. So, take careful look at these multiple choice questions. Test your knowledge of anatomy and note the explanations. Okay. So question 1. The upper lateral quadrant of the breast that extends into the axilla is known as. So the upper lateral quadrant of the breast that extends into the axilla is known as A. The suspensory ligament of axilla. B. Suspensory ligament of Cooper. C. Axillary tail of Spence. D. Clavipectoral fascia. E. Cervical axillary canal. So the answer to this question is the axillary tail of Spence. It is the upper lateral quadrant that extends into the axilla. The suspensory ligament of the axilla is a downward continuation of the clavipectoral fascia, and it actually pulls the base of the axilla upwards. The clavipectoral fascia is a fascia that extends from below the clavicle and also encloses the pectoralis minor and continues downward as the suspensory ligament of the axilla. The cervical axillary canal is found in the region of the apex of the axilla. So the answer is option C, axillary tail of Spence. Which of the following is not a rotator cuff muscle? A. Supraspinatus. B. Teres major. C. Infraspinatus. D. Subscapularis. E. Teres minor. So the answer to this question is Teres major. Okay, so option B is the correct answer. Why? The rotator cuff muscles, they form a musculotendinous cuff around the shoulder joint and they contribute to the stability of the shoulder joint. It can be remembered with a mnemonic, SITS, S-I-T-S. S is supraspinatus, I is infraspinatus, T is teres minor, and these three muscles sit on the greater tubercle of the humerus, while the fourth muscle is the subscapularis muscle, a multipennate muscle that sits on the lesser tubercle of the humerus. So the answer is teres major. Question 3. A 43-year-old woman is being examined as a candidate for cosmetic breast surgery. The surgeon notes that both of her breasts sag considerably. Which structure has most likely become stretched to result in this condition? So she's a 43-year-old woman and her breast sags considerably. Okay, it can be found in that age. The structure that most likely becomes stretched is actually the suspensory ligament of Cooper. So the correct answer to this question is option E, the suspensory ligament of Cooper. Okay, so the pectoralis major muscle is wrong. It's simply the muscle of the pectoral region. The serratus anterior muscle is wrong. It's a muscle with serrated edges on the side of the chest wall. The scapus fascia is wrong. The scapus fascia is the superficial fascia you find on the anterior abdominal wall. Okay, the fascia of scapa and the fascia of campa. Option D is also wrong. The suspensory ligament of Lockwood actually found in the eye. Suspensory ligament of Lockwood. So the answer is suspensory ligament of Cooper. And what forms the suspensory ligament of Cooper? It is actually formed by the connective tissue stroma of the breast. The stroma of the breast has a fibrous part and a fatty part. The fibrous stroma of the breast are thrown into strands known as the suspensory ligament of Cooper. Very, very important. So that is the answer. Okay, question 4. A 36-year-old pregnant female is admitted to the orthopedic clinic with symptoms of carpal tunnel syndrome. Which muscle most typically become weakened in this condition? So, which muscle most typically becomes weakened in carpal tunnel syndrome? This is a 36-year-old pregnant woman. So, pregnancy is a risk factor for carpal tunnel syndrome, okay, but it's not very common, okay, usually due to the retention of fluid during pregnancy and the effect of hormones on the muscles. So there's considerable enlargement or increase in the muscle mass, and this can lead to compression of the median nerve within the carpal tunnel. So carpal tunnel syndrome is the commonest form of nerve entrapment, and there are so many etiologies to that. So A. Lumbricals 3 and 4. B. Palmar interossi. C. Hypothenar muscles. D. Palmaris brevis. E. Thenar muscles. So the answer to this question is option E, the thenar muscles, because the thenar muscles are supplied by the median nerve, and if the median nerve gets entrapped, okay, there could be wasting of the thenar muscles, and this is what is known as the ape's hand deformity associated with carpal tunnel syndrome. Okay, there's flattening of the thenar eminence because of paralysis of the thenar muscles. So the answer is option E, thenar muscles. Question 5. A motorcyclist is brought to the emergency department of a hospital after a serious accident that affected his ulnar nerve. Which of the following muscles is unaffected? So this question simply means which of the following muscles is not supplied by the ulnar nerve. You understand? So we have the flexor carpi ulnaris as option B. It is supplied by the ulnar nerve. Medial half of flexor digitorum profundus is supplied by ulnar nerve. Lumbricals 3 and 4 are supplied by ulnar nerve. Palmar interossi, both the palmar and dorsal interossi muscles are supplied by the ulnar nerve. So automatically the answer to this question is the extensor carpi ulnaris. So the extensor carpi ulnaris muscle is supplied by the radial nerve. The radial nerve is the nerve supply that supplies the extensor compartments of the arm and the forearm. So the answer is extensor carpi ulnaris. So this is a brain teaser. What is the collective noun for a group of ravens? A group of ravens. Okay, a group of ravens is known as an unkindness or a conspiracy. You either call them an unkindness or a conspiracy. Maybe they are not kind enough. Who knows? Check that. Question 6. The conoid tubercle and trapezoid ridge is found on which bone? So the conoid tubercle, the tubercle is a rounded elevation. The trapezoid ridges are roughened, elevated bony surfaces. Okay, they are actually found on the clavicle. So the answer to this question is option C. They are found on the clavicle. And they provide attachment for the conoid and the trapezoid parts of a ligament. Okay, it's not found on the scapula, it's not found on the 7th cervical vertebrae, it's far from that. It's not found on the humerus. So the answer is clavicle. Question 7. A 27-year-old man was admitted to the emergency department after an automobile collision in which he suffered a fracture of the lateral border of the scapula. 6 weeks after the accident, physical examination reveals weakness in medial rotation and adduction of the humerus. Which nerve was most likely injured? So the first trick to this question is there is fracture of the lateral border of the scapula. You have to take note of that. The second thing here to remember is there is weakness in medial rotation and adduction. So you need to know the muscles that are affected. And if you are saying that the muscle that is affected there is the teres major muscle, we are definitely on the same page. And the nerve supply to teres major is the lower subscapular nerve. So the answer to this question is the lower subscapular nerve. Very, very important. Okay, so the next question is question 8. Which of the following statements is false? A. The pectoral girdle is a complete girdle. The pectoral girdle is an incomplete girdle. So this is the answer to this question. It's an incomplete girdle. Okay. So it has an articulation anteriorly but there is no bony articulation posteriorly. Okay, so the pelvic girdle is a complete girdle, that is true. The clavicle is the only long bone that lies horizontally. It's one of the peculiarities of the clavicle. It's an S-shaped long bone. The subclavius depresses the clavicle. Very, very correct. The axillary tail passes through the foramen of Lange. Of course, that is true. It passes through the foramen of Lange to get into the axillary fascia. So the pectoral girdle is a complete girdle, is false. It is an incomplete girdle. Question 9. Which of the following is true? So you are going to have lots of false statements here. You just choose the most appropriate statement, which is true. A. The ulnar nerve passes posterior to the lateral epicondyle. This was a trap. This is a trap in this question. The ulnar nerve passes posterior to the medial epicondyle. That makes it false. Ligament of Struthers is occasionally found on the tibia. Not really. Not really. The ligament of Struthers are rather found as a fibrous band on the humerus. It is found in few percent of the population. Option C. Palmaris longus is supplied by palmar cutaneous branch of the ulnar nerve. The trick in this question is ulnar nerve. The palmaris longus is supplied by the median nerve and not by the ulnar nerve. It is a superficial muscle of the flexor compartment of the forearm. Option D. The median nerve passes between the two heads of Pronator teres. And this is the answer to this question. The median nerve passes between the two heads of the Pronator teres. Okay, it leaves the cubital fossa by passing between the two heads of the Pronator teres muscle, from where it enters the anterior compartment of the forearm and lies in a muscle plane between the flexor digitorum superficialis and flexor digitorum profundus. Option E says the superficial radial nerve continues as lateral cutaneous nerve of forearm. That is false. It is not the superficial radial nerve. It is rather the musculocutaneous nerve that continues as the lateral cutaneous nerve of the forearm after piercing the deep fascia. All right. Question 10. While walking to his classroom building, a first-year medical student slipped on the wet pavement and fell against the curb. This is not really a good welcome as a first-year student. Injuring his right arm. So right arm injury. Radiographic images showed a mid-shaft fracture of the humerus. Which pair of structures was most likely injured at the fracture site? So fracture of mid-shaft of humerus, what are the structures susceptible to injury? Axillary nerve and posterior circumflex humeral artery, wrong. This is not the surgical neck. B. Suprascapular nerve and artery, not really. Option C. Long thoracic nerve and suprascapular artery, is far from that. Option D. Radial nerve and profunda brachial artery, and this is the correct answer. What are the contents of the radial groove or the radial sulcus or the spiral groove or the spiral sulcus? The radial groove contains the radial nerve and it is accompanied by the profunda brachial artery, which is the deep branch of the brachial artery. Ulnar nerve and ulnar artery, option E, is wrong. They pass behind the medial epicondyle of the humerus. All right. Question 11. The finger-like projection of the scapula with primitive atavistic type of epiphysis is known as. So the superior border of the scapula, okay, has a finger-like projection. And that finger-like projection is called a coracoid process. So the answer to this question is option C, the coracoid process. So the options include conoid process, conoid tubercle, spinous process, acromion process. In this case, I'm not going to trust the process because other options are wrong. I'm only going to trust the coracoid process. And that is the answer to this question. The acromion process fans out laterally as a continuation of the spine of scapula. The spinous process is found on the dorsal surface and divides the dorsal surface of scapula into the supraspinous fossa and infraspinous fossa. Okay. So while the conoid tubercle is found on the clavicle. Which is incorrect about extensor carpi radialis longus? So which of this is false about the long extensor, okay, that inserts on the carpal bone and its tendon runs along the radial border of the arm? This is called the extensor carpi radialis longus. A. It is innervated by radial nerve. Of course it is. innervated by radial nerve. B, it assists in abduction of the wrist. It is an abductor. C, it passes through the second compartment of the extensor retinal column. Very true. The second compartment, transmits the extensor carpi radialis longus and the extensor carpi radialis brevis. Option D, it takes origin from lower one-third of lateral supracondylar ridge. That's very, very true. Very close to the lateral epicondyle, which is the common extensor origin. However, there's a muscle that also takes origin from the lateral supracondylar ridge, but in this case from the upper to third, and that muscle is called the brachioradialis, of a muscle formerly known as the supinator longus muscle. So option E inserts on the palmar aspect of the base of sacrum metacarpal. Here is the catch here. The extensor carpi radialis longus, it is an extensor, so it inserts on the dorsal aspect, not on the palmar aspect. Therefore, the answer to this question is option E. That is the odd option. Okay. Which is accurate regarding pronator teres? So it's a pronator. A, it is a deep pronator of the anterior compartment of the forearm. It is not a deep pronator. This makes it wrong. B, it is innervated by main stem of median nerve. Very, very true. The median nerve innervates the pronator teres muscle. In fact, it's the first muscle that is innervated by the median nerve. And what is the deal? The pronator teres allows the median nerve to pass between its humeroradial and ulnar head. And what does it get in return? It gets a nerve supply in return. Option C, it has 3 heads of origin. No, it has 2. Option D, it forms the lateral boundary of cubital fossa. Of course, the pronator teres forms the medial boundary, not the lateral boundary. Option E, its tendon continues as pronator quadratus. That is false. Okay. About the brachioradialis, choose the odd option. A, it takes origin from upper to third of the lateral supracondylar ridge of the humerus. B, it inserts on lateral surface of the distal end of radius, just above the styloid process. Yes, usually inserts on the base of the styloid process. Option C, it forms the lateral boundary of the cubital fossa. Of course. Option D, it flexes the elbow joint, pronates the supinated forearm to meet prone position, and supinates the pronated forearm to meet prone position. Then option E, it is the workhorse of the elbow joint. It is not the workhorse. The workhorse flexor of the elbow joint is the brachialis muscle. So the brachioradialis is not the workhorse. That is for the brachialis. Okay? So that's the answer. Which of the following arteries is most likely at risk during venipuncture at the cubital fossa? So the hint here is cubital fossa. So it has to be an artery found within the cubital fossa. Remember your MBBR. And what is the first B in MBBR? It's the brachial artery. So the answer is the brachial artery. The radial and ulnar artery are given off at the level of the neck of the radius. They are not very susceptible to injury there. The common interosseous artery, not really. The anterior interosseous artery, not really. Another brain teaser. What's the collective noun for a group of hawks? A group of hawks is known as what? Okay, and if you're boiling hot water in your kettle right now, you're absolutely doing the best. So it's called a kettle. So a group of hawks is known as a kettle. So a kettle of hawks. Maybe they should be boiled using kettles. Who knows? Question 16. The superior ulnar collateral artery is a branch of... So the superior ulnar collateral artery is one of those branches that arises directly from the brachial artery. It is a direct branch of the brachial artery. Correct answer is option C. Option A says ulnar artery. Ulnar artery is a terminal branch of the brachial artery. Recurrent radial artery is a branch of radial artery. Middle collateral artery is also called the posterior descending branch of the profunda brachii. It's not a direct branch of brachial artery. The option E says the supratrochlear artery. The supratrochlear artery, or the inferior ulnar collateral artery, arises from the main stem of the brachial artery itself. So you can see that. Which of these nerves is most likely affected in wrist drop? Why would you want to drop your wrist? You want to drop your wrist if there is injury to your radial nerve. And what is the deep branch of the radial nerve? The deep branch of the radial nerve is the posterior interosseous nerve. So be careful of those nerves with the name interosseous. They are usually the deep branch of either the radial nerve or the medial nerve. The posterior interosseous nerve is to the radial nerve what the anterior interosseous nerve is to the medial nerve. So option A says anterior interosseous nerve, false. Posterior cutaneous nerve of arm, no. Ulnar nerve, no. Articular branch of medial nerve to wrist joint, no. It's injury to the posterior interosseous nerve. Okay, so the extensors of the wrist are affected, and this results to wrist drop deformity. All right. A little bit of applied. A 49-year-old female who had suffered a myocardial infarction, that's an ischemic injury, must undergo a bypass graft procedure using the internal thoracic artery. That is wise. Which vessels will most likely continue to supply blood to the anterior part of the upper intercostal spaces? Yes, the internal thoracic artery gives the anterior intercostal arteries for the upper 6 spaces, while for the lower 6 spaces, it is direct branches of the musculophrenic. So if you are using internal thoracic artery for grafting, which artery is going to reinforce this blood supply? Remember that the posterior intercostal arteries are magnificent in their supply, so they can cover up for that. And the answer to this question is the posterior intercostal artery. So the posterior intercostal arteries are gonna do that job. All right. Superior epigastric artery is wrong. This artery is a terminal branch of the internal thoracic artery, and it descends and passes through the angle of Larrey from where it enters the rectus sheath, and anastomosis with the inferior epigastric artery, forming what is called the anastomosis within the rectus sheath. The pericardiophrenik artery, as the name implies, will supply the pericardium and also innervate the circumference of the diaphragm. That's why the name is phrenic. The lateral thoracic artery is not part of it. Okay. Which of the following is correct? A. Supracondylar fracture predisposes to Dupuytren's contracture. So this question is, which of the following is incorrect? So which is not correct? Which of the following is incorrect? A. Supracondylar fracture predisposes to Dupuytren's contracture. And this is the answer to the question. Supracondylar fracture does not predispose to Dupuytren's contracture. Okay. Rather, what supracondylar fracture causes is Volkmann's ischemic contractures. So this right here should be Volkmann's and not Dupuytren's, and this makes option A the correct answer. So option A is not true. So one of the following is incorrect. The incorrect option is supracondylar fracture predisposes to Dupuytren's contracture. Option B, the brachial artery can be effectively compressed against the shaft of Humerus at the level of insertion of coracobrachialis to stop the hemorrhage in the upper limb occurring from any artery distal to the brachial artery. That is true. That is true. It is done as an intervention. Option C, arterial anastomosis around the elbow takes place between the branches of brachial artery and those from the upper ends. Of radial and ulnar arteries. That is true. Option D, posterior descending artery, anastomosis with interosseous recurrent artery behind the lateral epicondyle. Perfect. Option E, Radial artery is a smaller terminal branch of the brachial artery. Of course, it is a smaller terminal branch. Question 20. Which of these ligaments is most directly affected in dislocation of the head of radius? The head of radius doesn't deserve that. A. Interosseous ligament. B. Radial collateral ligament. C. Annular ligament. Another ligament is the annular ligament of the superior radioulnar joint. The annular ligament of the proximal or superior radioulnar joint is what is affected in this case. Okay? So the next question says, what's the collective noun for a group of eagles? This is another brain teaser. So what do you call a group of eagles? A group of eagles is known as a convocation of eagles. A convocation. So it's graduation time. Get ready for convocation. So it's a convocation of eagles. Question 21. Concerning the cubital fossa, which of the following is true? A. Most medial and most lateral structures are nerves. And this is the answer. Remember your MBBR mnemonic for the contents of the cubital fossa. Median nerve, brachial artery, biceps brachial tendon, and radial nerve from medial to lateral. So the most medial, median nerve, most lateral, radial nerve, and that gives you the answer to this question. All right. So the answer is A. Question 22. A 30-year-old man is admitted to the emergency department in an unconscious state. The triage officer takes a radial pulse to determine the heart rate of the patient. This pulse is fed lateral to which tendon? A. Abductor pollicis longus. B. Flexor carpi ulnaris. C. Extensor pollicis brevis. D. Extensor carpi radialis longus. E. Flexor carpi radialis. So the radial pulse is fed lateral to the flexor carpi radialis muscle. So the answer is option E, flexor carpi radialis. Okay. Concerning the triceps muscle, select the most appropriate option. A. The long head takes origin from the supraglenoid tubercle. B. The three tendons unite and insert on the coronoid process of ulnar. C. Medial head takes origin from above the radial groove. D. Between the medial and lateral head of triceps lies the spiral groove containing the radial nerve and profunda brachial artery. And this is the answer to the question. Okay, so the spiral groove or the radial sulcus contains the profunda brachial artery and the radial nerve. And the radial groove is found between two heads of the triceps brachii, the medial and lateral head, and the posterior shaft of the humerus. It's an oblique sulcus. 24. Workhorse of the forearm flexion is the brachialis. Option B is the brachialis. Is the brachialis muscle. So it is not brachioradialis. Take note of that. Option B. 25. The most lateral bony point of the shoulder region is intertubercular sulcus, lesser tubercle of humerus, greater tubercle of humerus, morphological neck, coracoid process. Is the greater tubercle of the humerus. So it's the greater tubercle of the humerus. That is the answer. Question 25. Answer. 26. The most preferred vein for venipuncture in the upper limb is the median cubital vein is the vein of choice. The median cubital vein is the vein of choice in intravenous infusion. The median cubital vein is the vein of choice in intravenous infusion. Okay? Within the upper limb. Question 27. After a forceps delivery, this is an interventional delivery. After a forceps delivery of a male infant, the baby presents with his left upper limb adducted, ADD, internally rotated, and flexed at the wrists. The stator reflex is absent on the ipsilateral side. So there is absent stator reflex on the affected side. Which part of the brachial plexus was most likely injured during this delivery? A. Roots of lower trunk. This is not clump case. This is not clump case. B. Medial cord. This is not ulnar claw hand. C. Roots of middle trunk. Not at all. D. Posterior cord. This is not wrist drop from radial nerve injury. E. Root of upper trunk. And if you are going with E, we are on the same page. Some chocolates for you. So the correct answer is option E. This is classical description of Erb's Duchenne's paralysis, an upper trunk nerve injury that occurs at the level known as the Erb's point. Okay? So the roots of upper trunk is the waiter's steep hand, the policeman's steep hand, the porter's steep hand. The arm is adducted and internally rotated or medially rotated. Okay? Why the forearm is extended and pronated. Good. Question 28. Damage of the radial nerve in spiral groove causes only weakness in extension of elbow and not the total inability to extend elbow because A. Branches of the radial nerve supplying long and medial heads of triceps arise in axilla above the radial groove. And this is the answer. This is a board question. Okay, it has been asked in some exams, and this is the answer. So these nerves actually arise higher up, and so they do not really affect some of the heads of the triceps. So that's the answer. 29. Fibrous band extending between the supratrochlear spur and medial epicondyle of humerus is known as A. Ligament of Mackenrod. Not at all. The ligament of Mackenrod are also called the cardinal ligament of the uterus. B. Ligament of Bigelow. The ligament of Bigelow is simply the iliofemoral ligament. Option C. Ligament of Gimbenats. The ligament of Gimbenats are the lacunar ligaments that you found just medial to the inguinal ligament or ligament of Poupart. Option D. Ligament of Struthers, and that is the answer. So the ligament of Struthers, reported by John Struthers, is a fibrous band that extends between the supratrochlear spur and medial epicondyle of the humerus. It is found in few percent of the population. Option E says pectineal ligament of Cooper. Pectineal ligament of Cooper continue as a medial extension of the lacunar ligament or ligament of Gimbenat. Question 30. Which of these is regarded as the workhorse of the forearm extension? Here's the catch. Extension. Okay. So the answer to this question is the medial head of triceps brachii. So the medial head of the triceps brachii is the workhorse of forearm extension. Medial head of triceps. Oh, this sounds funny. What is the collective noun for a group of owl? those birds with big eyes that you can find in the night. Okay, so when they gather, they have come to decide. So it's not really witchcraft. A group of owls is called a parliament of owls. So when they gather, probably they decide people's fate. Who knows? Question 31. Which of the following statements is incorrect about the profunda brachii? The profunda brachii gives a deltoid branch. That is true, and that branch ascends between long and lateral head of triceps and anastomosis with the descending branch of the posterior circumference humeral artery. That's true. Option B. It gives us an anterior descending branch, which is a smaller terminal branch that accompanies the radial nerve, and anastomosis with the radial recurrent artery in front of the lateral epicondyle of the humerus. That is true. Option C. It gives us a nutrient branch which enters the shaft of humerus in the radial groove just behind the deltoid tuberosity. Yes, it feeds the humerus. Option D. The middle collateral artery is the larger terminal branch of the profunda brachii. That option is true. Okay, and it accompanies an anastomosis with the interosseous recurrent arteries. Option E, it gives off the inferior ulnar collateral artery that descends above the trochlea. Alright, so which is incorrect? So this question has a problem. Profunda brachii gives a deltoid branch. Profunda brachii gives an anterior descending branch. It gives off a nutrient branch occasionally. Option D, the middle collateral artery is a larger terminal branch of profunda brachii, okay, which descend behind the shaft of humerus and anastomosis with the interosseous recurrent artery behind the lateral epicondyle of the humerus. This option is also true about the profunda brachii. Option E, it gives off the inferior ulnar collateral artery that descends above the trochlea. Oh, I get it right now. So the inferior ulnar collateral artery is not a branch, not a direct branch of the profunda brachii. The inferior ulnar collateral artery is rather a direct branch of the brachial artery and not the profunda brachii. So the answer to this question is option E. Option E. So in your exams, read very well, read in between the lines and get the twist. So option E. All of these are related to the coracoid process. A, musculocutaneous nerve. Yes, it crosses it obliquely as it leaves the lateral cord. B, pectoralis minor. Yes, it inserts on the medial border of the coracoid process. C, coracobrachialis. Yes, it takes origin from the tip of the coracoid process. D, short head of biceps brachii. It also takes origin from the tip of the coracoid process. Then E, axillary nerve. The axillary nerve is not related to the coracoid process. So the wrong option right here is the axillary nerve. So the answer to this question is axillary nerve. Question 33. Which of the following is false about long thoracic nerve? A, it is the precious innervator of the serratus anterior. Correct. It is also called nerve of Bell. Correct. C, injury to this nerve causes winging of the scapula. That is what it is known for. You dare not injure the serratus anterior muscle by hitting the long thoracic nerve, okay, to make your scapula wing. Option D, it is very susceptible to injury within the axilla. Very true. Which other nerve is susceptible to injury within the axilla? It's the intercostobrachial nerve. Option E, injury to this nerve is associated with scaphoid scapula. Option E is wrong. Scaphoid scapula is not a result of injury to the long thoracic nerve. It's not. It has to do with increasing the concavity of the medial border of the scapula. Question 34. Which is false? F-A-L-S-E. Which is false concerning shoulder joint? A. It is an amphiarthrosis. B. It is a multiaxial joint. C. It is a synovial joint of ball and socket variety. D. It is the most commonly dislocated joint. E. What is gained in mobility? It lost in stability. The last four options, option B to E, are all true about the shoulder joint. So it is a multiaxial synovial joint of ball and socket variety that permits wide range of movement. However, it is the most easily dislocated joint in the body. So what it gained in mobility, it lost in stability. The only exception here is option A. It is an amphiarthrosis. So the shoulder joint is not an amphiarthrosis. Dash is not a relevant clinical correlate pertaining the shoulder joint. A. Frozen shoulder. Of course it is. It is also known as adhesive capsulitis of the shoulder joint. B. Rotator cuff syndrome. Yes, rotator cuff syndrome is associated with shoulder joints, okay, because the shoulder joint is stabilized by a group of tendons that blend and form a musculotendinous cuff. Okay, go and read more about positive Dolban sign. Option C, anterior compartment syndrome. And that is the wrong answer. So it is not associated with anterior compartment syndrome. Anterior compartment syndrome occurs in compartments. Okay, compartments of the limbs. Option D, supraspinatus tendinitis. It is associated with shoulder joint. Subacromial bursitis is also associated with shoulder joint. So anterior compartment syndrome. One of these is not a property of the acromion. A, it is the superolateral projection of the spine of scapula. That is true. B, it fans out and articulates with the lateral end of the clavicle. Yes, it does. It articulates with the lateral end of the clavicle. C, it provides surface for attachment of deltoid and trapezius muscles. And that is true. Option D, it has two surfaces and two borders. That is true. Option E, it gives origin to the inferior belly of omohyoid. This is wrong. The inferior belly of omohyoid takes origin from close to the suprascapular notch. Okay, that's the inferior belly of omohyoid. Question 37. Which is incorrect about the vertebral border of the scapula? Remember that the vertebral border of the scapula is the medial border of the scapula. A, it extends from superior angle to the inferior angle. True. B, it is thin and angled at the root of spine of scapula. That is correct. C, the serratus anterior muscle is inserted on the costal surface of the medial border and inferior angle. That is true. Option D, levator scapulae is inserted on the ventral aspect of the medial border from superior angle to the root of the spine. And there's a catch here. Levator scapulae is not inserted on the ventral aspect. It is inserted on the dorsal aspect. Okay? Inserted on the dorsal aspect. Option E, the rhomboidus minor muscle is inserted on the dorsal aspect of the medial border opposite the root of the spine. So the answer to this question is option E. That is the wrong or odd option. Which is true concerning the spine of scapula? A, the anterior border of spine is attached to the ventral surface of the scapula. This is wrong. It is attached to the dorsal surface, and it divides the dorsal surface of scapula into a smaller supraspinous fossa that lodges the supraspinatus and a larger infraspinous fossa that lodges the infraspinatus. Option B, The lateral border of the spine bounds the spinoglenoid notch, through which passes suprascapular nerve and vessels from supraspinous fossa to infraspinous fossa. So the answer to this question is option B. That is true. Concerning the latissimus dorsi, which is false? A. It is a large muscle of the back. B. It has a very wide origin and a narrow insertion. Very true. C. It is the climbing muscle. D. It twists around teres major to form the posterior axillary fold. Of course, the teres major muscle twists around the latissimus dorsi to form the posterior axillary fold. And the tendon of teres major at this point is glistening. So it's called the glistening tendon of teres major. Option E, it is the boxer's muscle, is wrong. Latissimus dorsi is not the boxer's muscle. The boxer's muscle is serratus anterior. Congenital high scapula is also known as A. Scaphoid scapula. B. Sprengel's deformity of the scapula, and that is the answer. The Sprengel's deformity of the scapula is also known as the congenital high scapula. Rentgen scapula, hyperplastic scapula, scapular malunion, those options are wrong. The upper end of humerus presents the following features, except A. Head, B. Bicipital groove, C. Spiral sulcus, D. Greater tubercle, E. Lesser tubercle. So the upper end of the humerus is divided into an articular part and a non-articular part. The articular part is only composed of the head of humerus. The non-articular parts are the greater and lesser tubercle separated by the sulci. So the answer to this question is the spiral sulcus. The spiral sulcus is found at the mid-arm level. The rhomboidus major and minor is supplied by which of the following nerves? A. Upper subscapular nerve, B. Long thoracic nerve, C. Dorsal scapular nerve, D. Suprascapular nerve, E. Middle subscapular nerve. So the answer to this question is the dorsal scapular nerve. It's also called the nerve to the rhomboids. So it supplies the rhomboidus major and rhomboidus minor and terminates by supplying the levator scapulae, the proud elevator of the scapula. And you may want to ask, is there any nerve called middle subscapular nerve? Yes. The middle subscapular nerve is also called the thoracodorsal nerve. Volkmann's ischemic contracture is very associated with supracondylar fracture of the humerus. So if there's supracondylar fracture of the humerus, there could be occlusion of the brachial artery, and this could lead to Volkmann's ischemic contracture. Smith fracture, Colles fracture, you find them on the radius, Bennett fracture, and etc. So the Colles fracture is also called the reversed Smith fracture. The Bennett fracture is actually the fracture of the base of the first metacarpal. The largest nutrient foramen is the tibia. If you're on the same page with me, tibia, chocolate for you, some chocolate. So it's the tibia. Which of the following is not supplied by the posterior interosseous nerve? Okay, which of the following is not supplied by the anterior interosseous nerve? A. Palmaris longus. B. Pronator quadratus. C. Flexor pollicis longus. Palmaris longus, Pronator quadratus, Flexor pollicis longus, Flexor digitorum profundus, proximal radio-ulnar joint. So the palmaris longus is not supplied by the anterior interosseous nerve. Okay, the palmaris longus is not supplied by the anterior interosseous nerve. Okay. A middle-aged female tennis professional is informed by her physician that she has a rotator cuff injury that will require surgery. Her physician explains that over the years of play, a shoulder ligament has gradually caused severe damage to the underlying muscle. To which of the following ligaments is the physician most likely referring? Acromioclavicular ligament, coracohumeral ligament, transverse scapular ligament, glenohumeral ligament, coracoacromial ligament. Is the coracoacromial ligament. It prevents superior dislocation of the shoulder. And there are some other ligaments, okay? Some other ligaments that can be involved at different joints. But for this, it is the coracoacromial ligament. A 19-year-old man is brought to the emergency department after dislocating his shoulder while playing soccer. Following reduction of the dislocation, he has pain over the dorsal region of the shoulder and cannot abduct the arm normally. An MRI on the shoulder shows a torn muscle. Which of the following muscles is most likely to have been damaged by this injury? So loss of abduction of the arm has to be the supraspinatus. So the correct answer is option D, the supraspinatus. Question 48. A 23-year-old female had a painful injury to her hand in a dry ski slope competition, in which she fell and cut her thumb in the meeting. Radiographic and physical examinations reveal rupture of the ulnar collateral ligament of the metacarpophalangeal joint (MCP) of the thumb. Lidocaine is injected into the area to relieve the pain, and she is scheduled for a surgical repair. From which of the following clinical problems is she suffering from? Okay, this is a case for clinical diagnosis. A. De Quervain's syndrome. B. Navicular bone fracture. C. Gamekeeper's thumb. D. Boxer's thumb. E. Bennett's thumb. And the correct answer to this is Gamekeeper's thumb. The name took its origin, okay, from when people who go to hunt, they are able of using their thumb and index finger to trap down rodents against the ground. So they often suffer from this injury. That is why it took its name from, as the gamekeeper's thumb. Boxer's thumb, no. Bennett's thumb. Bennett's thumb, due to Bennett's fracture, occurs when there is fracture of the base of the metacarpals. De Quervain's syndrome is painful sensation along the lateral aspect of the wrist due to involvement of the flexor tendons. It's a form of tenosynovitis. So gamekeeper's thumb. Question 48. The nerve to teres minor can be easily recognized during surgical procedures because it possesses pseudoganglion. It's another high yield question you should know for board exam. It possesses a pseudoganglion. All right. The boxer's muscle is the muscle with serrated edges, the serratus anterior. Let's look at other options. So other options says latissimus dorsi, that's the climbing muscle. Scalenus anterior is the anterior scalene. Scalenus minimus, it degenerates. Scalenus minimus degenerates as and persists as the suprapleural membrane or the Simpson's fascia. Question 50. A 45-year-old female is admitted to the hospital with painful arm after a strongest man in the world contest. Physical examination gives evidence of a rupture of the long tendon of the biceps brachii. Which of the following is the most likely location of the rupture? A. Intertubercular groove, wrong. B. Mid portion of the biceps muscle, that is wrong. C. Junction with the short head of the biceps muscle, that is wrong. D. Proximal end of the combined biceps muscle. E. Bony insertion of the muscle. So, and the answer to this question is the bony insertion of the muscle. Okay, so the biceps brachii inserts on the deltoid, on the radial tuberosity. There could be avulsion of the radial tuberosity. Okay, and that is the answer to this question. So question 50 is option E. All right. What is the collective noun for a group of pandas? A group of pandas. Okay. A group of pandas is known as an embarrassment. An embarrassment of pandas. Don't know why they decide to embarrass themselves with their clumsy attitude. It's called an embarrassment of pandas. I think that sounds fun. Thanks for watching. Share, subscribe.